So the approval from the European Medicine Agency for Dara plus VMP, I think that was a great news for us, but especially for the elderly patients with newly diagnosed multiple myeloma. First, because myeloma usually affects to the elderly population, so most patients we see every day in our clinic are elderly patients older than 65. And in Europe, in Spain, VMP has been and continues being one of the standards of care we use every day for the treatment in the upfront setting. So now with this information coming from the ALCYONE, the phase 3 randomized trial, so we can potentially add Daratumumab to VMP. And if we decide to add Daratumumab to VMP, we are going to increase the efficacy because almost all patients are going to achieve at least partial response, 93%. 42% of them are going to achieve a complete response. 22% of them can achieve minimal residual disease negative. And all this information resulted into a significant benefit in terms of progression-free survival. And in fact, the median PFS has not been reached yet, but we are going to reduce the probability of progression and or death by 50% in comparison with VMP. And important, we are dealing elderly population. Toxicity profile is excellent, and Daratumumab did not result into new safety warning, in no more hematological, in no more non-hematological toxicity. Only more infections, more pneumonia, and maybe we can potentially to plan some prophylaxis with antibiotics, especially during the first cycles. But anyway, I think that we have the first new standard of care in the upfront setting with a monoclonal antibody, and in this case is the Daratumumab in combination with VMP.